stage renal disease. In 2010, I received both a kidney and pancreas transplant. Unfortunately, both organs only last for 7 months. So for the past 9 years, I have been on in-center hemodialysis. The beginning of my end-stage renal disease journey was very challenging, but I decided that I would not let kidney disease defeat me. I took charge of my health and are now relisted for a second kidney transplant. But this was not possible without dedicated and committed healthcare professionals like you all here at Quality Conference. With the extended support of my healthcare team and my fellow end-stage renal disease patient subject matter experts, I am now thriving on dialysis. Thank you. Millions around the country are affected by a chronic condition. Healthcare community, we have a job to do. As patients, we depend on you to better the healthcare system, to make it more efficient, to make it more cost-effective, and to make it more patient-centered. I am here and willing to sit with you and work with you to achieve the goal. In addition to our charge here at Quality Conference, I want to welcome all 3,500 of you to the 2019 CMS Quality Conference. Let's work.
Awesome job, Precious.
And now, please welcome Deputy Director for the Center for Clinical Standards and Quality, Janine Iwago. Director for the Quality Improvement and Innovation Group, Dennis Wagner. And the Chief Medical Officer of the Quality Improvement Centers for Medicare and Medicaid Services, Dr. Paul McCann.
Good morning, everyone. Thank you guys, all of you, for joining us at the CMS Quality Conference. Before we begin, I want to just thank Precious so much for joining us today. Having patients as the focus of our work and at the center of our work is really integral to everything that we do here. So can you just help me thank Precious for that? This is a picture of me in 2004, and this is a picture of me with my SSA colleagues at the time. This was at the very beginning of my federal career, and I've made some conscious choices since that time that have been extremely transformative for me, and so has our quality improvement community. We've worked to evolve into distinct, creative, and innovative networks. The BFCC QIOs, the Quinn QIOs, the HINs, we've become more agile, you've embraced new data strategies, and you've made a conscious effort to do those things with us. And we want to thank you so much for your work in this area. You've also consciously committed to bold goals and have achieved tremendous strides, great outcomes, and saved so many lives. Your momentum has created this conference and has grown this conference, as Precious mentioned, to over 3,000 registered attendees. And so we want to thank you for being here and welcome you to the 2019 CMS Quality Conference. So while you're here, please have fun. We are at work. We want to make sure that you connect with your partners, and that includes both the partners that you came here to meet, the people that you said, I'll see you at Quality Conference, and then all the people who you don't know. I want you to go out, meet somebody you didn't know, and also attend a session about something that you know nothing about. You will have wasted the 3 days if you only do the things that are in your zone that you're already knowledgeable about. Spread out, go into uncharted territory, and learn something that you didn't know before you came. So we also want to make sure that you stay connected with us throughout the conference. Please download the Guidebook app. It will have updates. It will also give you information about our speakers, their bios, and agenda changes should they happen. Please stay connected with us on Twitter, follow us, and use the CMS Quality Conference hashtag as you tweet about your experience here at the conference. We have a lot of work to do together. We've done tremendous work already, and we want to make sure that we stay committed to this push in quality improvement, that we renew commitments, that we connect around our united purpose, and that we nurture our resilience. And lastly, I want to make sure that you guys have fun. That really is important. There are a lot of people here, a lot of great minds, a lot of experts, and a lot of innovative ideas that we can spread. So thank you and welcome to the CMS Quality Conference.
You know, Janine just mentioned that we have a lot of real work to do. And people often ask us, especially employees, what's real work anyway? Like, how would you define real work? Well, what you see on the screen now, I hope, is what we think real work is. Real work consists of three main activities. The first is making commitments to get something done. The second is delivering on those commitments. And the third, which is really important at this conference, is securing commitments from others. So we have three requests for you for these 3 days. And the first is to do real work at the conference and get agreement and encourage others to do real work as well. There's no use in complaining or worrying or getting upset about anything that's happening. There are so many good results being generated by this community. Focus on them and generating more commitments. Our second request is to use a lot of the tools and methodologies and quality improvement that we've found to be so successful over the years. One of those tools is listed here on this slide. We call it DNA. And I've got 6 examples listed there. You can read them on your own. There are probably dozens and dozens more that all of you can add. But DNA stands for decide, notice, and acknowledge. And it's a real structured approach to generating positive results. So I'm going to notice it right now with that first commitment that you see on the slide, expand work to involve more patients and families in our work. You just saw a phenomenal presentation by Precious McCowan, who's never presented in front of an audience this large before. The reason that happened was because of her courage, because the leadership here decided to make it happen. I'm noticing it now for all of us to take note of. And I want to acknowledge once more that Precious did a phenomenal job in her presentation. So that's DNA with an example. And this is how it works. Decide what you want to see more of, notice around you when it shows up, and acknowledge people for their hard work in making things happen. If you conduct yourselves that way the next 3 days, it will make all the difference in the world. And now, Dennis, I think you have our final request and thanks.
All right, very good. So as Dr. McGann said, I do have several requests for you as we gear up for this quality conference. But before I get into that, I want to, first of all, thank you. The people in this room do an extraordinary amount of hard work to transform and improve the nation's healthcare system. And I want to acknowledge and thank you for that hard work. I also want to thank you for your unrelenting focus on the priorities of CMS. Last year at this conference, we asked you to align with the new priorities, meaningful measures, burden reduction, the opioid crisis, accelerating the transition from fee-for-service to value, and you've come through. We see that in all of the work that we do in partnership with you, that you do in partnership with each other, and with the frontline caregiver organizations that all of us are committed to supporting. This is a contractor community and a cooperative agreement partnership community that it competes routinely for contracts. And that's good. That's good for all of us. It makes us more efficient, and it drives down prices. It helps us to do more with less, and that's a wonderful thing. But I think the other thing that's equally or perhaps even more important is that this is a community that knows how to team with each other and with CMS, and I want to thank you for doing that. Going into the future, we need more than ever cost-effective approaches to doing our work and to supporting large numbers of providers. You're doing that now. We're going to be calling on you to do even more of that as we go through the competitive process to establish the QIO 12 scope of work. You are generating national results. I've been in 3 sessions already this morning where we're celebrating the improvements that you've generated in nursing homes, in hospitals, in clinical practices, and in communities. And you're going to hear more about some of those extraordinary results as the morning goes on, and you're going to hear it directly from CMS senior leadership. Now, I'm taking a page here from the book of Jean Moody Williams, one of my 4 bosses, and Janine Awugo, one of my other 4 bosses. They say it's important, you know, dentists, you're immersed in the work, but you've got to be personal. You've got to put yourself out there a little bit more personally, right? So some of you may recall that last year I shared with you an extraordinary journey, a pilgrimage that myself, my wife, and our 3 kids went on called the Camino de Santiago, a pilgrimage from France all the way across Spain, ending up at the Cathedral of St. James at Santiago de Compostela. It was amazing for our family. It was one of the most important things that's ever happened in the journey of our family. 34 days, 799 kilometers, which is about 500 miles. You go every day, rain or shine, wind, you name it. You carry your pack on your back, and we made it together, and it was amazing. So amazing, in fact, that my wife and I decided to go back last summer because we learned while we were there that yes, there's the Camino de Santiago that was established by King Charlemagne in about 880, but there actually was an earlier Camino that was conducted by King Alfonso II of Spain from his residence in Oviedo, Spain, through the mountains, so much more mountainous, much more remote route. That also terminates at the Cathedral of St. James in Santiago de Compostela. My wife and I went on the second pilgrimage. It was great. Our kids weren't there. It was more mountainous. It was a lot of up and down. More blisters. You may remember the blisters I mentioned last year. Lots of PDSAs on blisters, right? Another marriage encounter. All these really good things, right? I don't know how many of you have spent 34 days in a row with your wife 24/7. Like, that's a marriage encounter. There's no question about it. But as we were on about day 11 of the journey of the Camino Primitivo, the first Camino, I started to say things like, geez, you know, it's just not the same as the last one. You know, our kids aren't here. It's not as hard. We're going to reach our destination just in like 2 or 3 more days. And I was kind of lamenting about the difference between this one and the earlier one. And my wife said, Dennis, most families go on backpacking trips over a long weekend. This is 14 days through the mountains, up and down, right? Like, this is an extraordinary journey. You need to savor it. You need to recognize that we're doing this together, and it's a wonderful experience. And it was through that dialogue with my wife that I learned something important. I'd heard it before, and I'd even said it in speeches, but I don't think I really internalized it. And it's the title of this slide. The idea is that in life, the more we do, the more we can do. And I think in some ways, the modern world sort of teaches us the opposite. It's sort of, you know, you have this constant barrage of requests and offers and commitments and things that you need to do, and we're all swirling in this sort of pace of work and outcome and results and teaming. And I think we lose sight of the fact that we're getting better and better and better at what we're doing. So all of a sudden, for me and my wife, a 14-day journey was no big thing because we'd done a 34-day journey before. But this is also true of our work on quality improvement. And we're going to be calling on you, challenging you to do it faster, to do it better, with greater efficiencies, to be more patient-centered, greater accountability, more teaming, and more national results. So that's at the heart of the request that I'm making to you, to do these things. And to do these things as part of the competitive process that we're entering into with the QIO 12 scope of work. My final request is really all about being. You know, I used to think that the most important thing was the outcome, the result, the destination. And I still believe it's in the top 3, no question in my mind, right? But I think the other thing I've learned is that the journey and how we choose to be matters at least as much and maybe even more than the other thing. So as we spend this time together over the course of the next 3 days, and as we work together over the course of the coming weeks and months and years, our request is to be like this, to be aligning with the evolving CMS priorities. You're going to hear shortly from our administrator about those priorities, and we're asking you to lean into them in every possible way, to focus on the patients and the providers that we serve, to become more stewards of human-centered design, where we begin with the patient's needs at the beginning, to be improving, lower costs, more results, and greater value. I think I've hit that 3 times now. I hope you're hearing that, all right? Lower costs, greater efficiencies, more value. cultivating resilience, and as Janine said at the beginning, teaming with each other and establishing new and more productive and synergistic partnerships. It's by working together that we're really going to get the results that we're after. And as Dr. McCowan said, doing the real work of making requests and offers. You know, it's kind of beautiful. You make a request and somebody says yes, or you make an offer and somebody takes you up on it. In that moment, you create the future. You cause the future to come into being. And when you have 3,500 people in a room for 3 days making requests and offers to each other, as precious, you made an offer when you stood up here just a few moments ago. Extraordinary things can happen. The world can turn. And I would say, don't hesitate to ask us. We're open to your offers, and we're more than happy to respond, maybe with a counter offer, maybe with a counter request, or maybe with a yes, right? So let's get in that spirit. Let's do it that way. And in closing, I just want to say welcome again to the 2019 CMS Quality Conference.